I was this close to doing that. Actually, I did wait for just to go back.
So you can put your
All right, everyone, please welcome our next speaker, Dr. Andrew Therriault. His talk is Saving the World with Data, the Case for Civic Data Science. He is the first Chief Data Officer for the City of Boston, prior to which he was the Director of Data Science for the Democratic National Committee. He has also served as the editor for the publication Data and Democracy, How Political Data Science is Shaping the 2016 Elections, and he currently leads Boston's analytics team, which is a nationally recognized leader in applying data science to a wide range of critical city operations, such as public safety, transportation, citizen engagement, and public health.
Great, thank you. Thank you everyone for having me this morning. So as Austin said, I'm Andrew Therriault. I'm the Chief Data Officer for the City of Boston. That means I run the city's analytics team. It's a group of about 20 people working across all different areas. We work with almost every department in the city on everything from your basic performance management and performance tracking all the way to advanced data science. We do geospatial analytics, we do data engineering and so forth. We basically are the headquarters for everything that happens around the city that relates to data. We serve as the sort of central organization to help other departments manage their own data and find value in it. And we support some of the initiatives coming out of the mayor's office, actually including, to some degree, the past presentation. We were actually involved a bit once that actually rolled out, working with the public schools to look and see how performance was going and try to understand why we were having such difficulties in the first week or so of the implementation. So before this, I came out of academia back in 2011, 2012. I did a PhD in political science at NYU. I spent about 5 years doing applied data science and consulting, particularly with an emphasis on politics. And most notably, I was head of data science at the DNC until about June of 2016. So what I want to talk about today is something I call civic data science, and I'll get to what that means in a minute. But I want to talk about what it is and why it can help organizations and why I think it's a good area for people like yourselves to be involved in. So civic data science. The way I've defined it here is not any sort of canonical thing that you'll find in a book somewhere. This is a definition I came up with myself through the course of giving this talk a couple times and thinking through what this really means. And I think there are two real important parts to this definition. One, that civic data science is the application of data science methods broadly defined. So that's not just your fancy, super sexy machine learning, artificial intelligence, deep learning, all that stuff, but even things as basic as good data governance, data management, being able to track how things are going in the course of a program, for example. And I think the second part of it that's also important is that the purpose of civic data science is to support the work of organizations like nonprofits or governments or advocacy groups, which exist to deliver positive social impacts. And note that what a positive social impact is for me might be different from some of you. It doesn't really matter what that impact is. The idea is that the purpose of the organization is to make that impact as their primary goal. That's not just a secondary output of the course of doing, say, a for-profit business. And the reason I define it as such is that, first off, these civic organizations matter. There's a lot of talk about the tech sector and how it's changing the world and delivering all these new and great things, and to some degree that's true. And certainly there are organizations, say, in Silicon Valley that are making a positive difference. But the thing to remember is that those organizations exist first and foremost as for-profit companies. The city of Boston, for example, is about on the threshold of being what would equivalently be a Fortune 500 company. We have a bit over $3 billion in revenue a year. And the difference between us and, say, a company like, I don't know, Wayfair, which is a company about the same amount of revenue as we have in our budget, they may do some social good on the side. For us, the entire $3+ billion of our budget is spent towards making life better in the city of Boston. We can have debates about how effective that is, certainly, but the goal is not to make money for any individuals or stakeholders and so forth. The point is to do good with that money. And data science is really a good fit for these kinds of organizations because of a few things about data science and these organizations. That, when I'm talking about data science, there are two things that I often bring up. One, efficiency, and two, effectiveness. That data science can really help to take resources and spend them more efficiently, and then when they are spent, to make them as effective as possible. And because these sorts of civic organizations are almost always resource constrained, they have as much of a use for data science as any organization you could imagine. And beyond just being important, I think the other thing to remember about working in civic data science is it's also fun. So these kinds of organizations, we work on a variety of different projects. So I mentioned the Fortune 500 company analogy. Well, you take your average Fortune 500 company, they have a few different business lines. But the scope of work, if you were to go and be a data scientist at one of these companies, is pretty narrow. For us, we work, just on our team alone, with about 3 times as many departments as we have people on our team. So everybody on the team is involved in a wide variety of different projects. The people on the team and the people we work with in different departments are all really highly motivated. You don't go work for a city because you want to make a lot of money. That's a terrible, terrible idea, and I don't encourage anybody to do it. You go and work because you care about what you do, and you want to work on things that have meaning. And working in an environment with people like that is really rewarding. But also it allows you to not only work on a variety of different projects, but to be able to get involved at a really high level. So, I think if you were to go and work, say, at a Facebook or a Google, and you're an early career data scientist, you work on a couple projects, you'll work on a large team, there'll be a lot of things going on, and you'll probably be doing the grunt work for the first couple years. And whereas if you come to a team like ours, we would basically say, well, what skills do you have? Great, we're going to use them all right away, and if you want to learn new ones, we'll use those ones too. So I want to talk about what this really means in practice by just going through a handful of different examples of civic data science projects that I've worked on over time. So to start off, one that we've done in the city. So for almost 2 years now, the city's been targeting all of its unscheduled restaurant inspections by using an algorithm. So basically the way inspections work in the city is that every food establishment gets inspected between 1 and 3 times a year on a schedule, depending on the kind of establishment it is. And then in between those scheduled inspections, our inspectors have discretion about where they go. So traditionally, that's been based on inspectors knowing their own territories and knowing, what's happened the last few times they've gone to a particular establishment. But there wasn't a systematic way of determining where these unscheduled inspections happen. And so in early 2016, we pilot tested a model which would say, instead of, leaving it up to the inspectors to say, well, what are we trying to optimize on here? Well, what we're trying to optimize on here is to find places that are having serious food safety violations. And so we built a predictive model which said, well, if we were to go into any of these given food establishments tomorrow, where would we be most likely to find a critical violation? And we came up with lists, and we pilot tested these. We gave some inspectors these targeted lists. We had others just go about their normal business. And we found that we were getting about 25% higher rates of finding critical inspections when we used these high priority targets derived by the algorithms. And we rolled it out for full-scale use for another 6 months. We went back, we analyzed, and we found that we were getting better performance year over year of about 20 to 25%. That result was holding up. And so, this sounds pretty boring in a way that, well, we're just talking about inspectors and, they're doing their jobs a little more efficiently. But the point of doing this isn't to go out and issue fines. The point is to protect the health and safety of people eating at these establishments. And if you've gotten food poisoning at any point in the past few years, you probably remember that it's hell. And if we can stop even a few cases of that, it's actually making a significant difference in quality of life. So we also think about this same kind of approach working in other areas. So one that we're going towards now is around school attendance and performance. So how do we identify students at risk of not showing up to school, at failing, at dropping out? Well, we want to figure out what are the predictors that we can look for. For example, it might involve things around the student's housing situation or things going on in their neighborhoods. Maybe their apartment building had a fire in it and they've been living on a friend's couch for a while. These are kinds of things where it's not necessarily that we're going to find some pattern we never would have thought before. In the same way, with the food inspection models, the thing about these models is not that they find some patterns you'd never expect. It's that they do what computers are really good at, which is to implement what I like to think of as common sense at scale. So our restaurant inspectors they're experts. They've been doing this for years and years. I don't expect that a computer that's never been to these restaurants could do their job better than they can. But what I do know that the computer can do is read through, for example, all of the Yelp reviews about every restaurant in the city over the past week. And if a particular restaurant has been flagged as, say, having a rodent problem, or if somebody said they got sick there, the computers can find that. We don't expect an inspector to do that same thing. And so what we're really doing is creating a human-in-the-loop system where we use the computer algorithms to go in and distill all of this data from a variety of sources, both internal and external, distill it down to a list of high-priority targets, and then we bring the experts in, the people, to come and validate what the models found. And in the same way, we're thinking with this project around students is that this isn't a tool to identify students at risk and then act based on that. It's to give information to principals and guidance counselors and teachers in order for them to be able to then pay more attention to certain students, because they're always overburdened. Again, we get back to that resource constraint issue, which is why I think data science is a really good fit for these kinds of organizations. If we were in a world where we had enough principals and guidance counselors and teachers to pay attention to everything that's going on in every one of these students' lives at all times, we wouldn't need a model. The thing is they're overburdened and they can miss things. And so by making a model, maybe we can help find something that they would have otherwise missed, and we can get at one of these students before we get to a point where they've really reached a crisis. So another project that I've worked on was around healthcare enrollment. This was something that we did in California at one of my previous consulting firms. We had been working in 2012 on a campaign for the California Labor Federation, a group of different unions throughout California. We'd been working on a ballot proposition. And after the election, things had gone well, and we got a call from the SEIU United Healthcare Workers in California, and they were actually preparing for the rollout of Obamacare later in 2013 and 2014, and had been working on this program to do targeted healthcare enrollment outreach using existing public programs. And they went out, they knocked on doors, they set up tables, they made phone calls, and what they found was they were having a hell of a time doing this at a level of efficiency where it really was paying off, because the existing public programs they had different criteria around things like need and eligibility, and they were going out and they were talking to a lot of people, and the problem was they just weren't reaching enough who both needed healthcare and were eligible for these different programs. So they came to us and they said, well, you did this sort of thing for us during the election to find people who are potential voters for this ballot initiative, or in this case against this ballot initiative. Can you do the same thing for healthcare? And we said, well, we don't know, but we'll give it a shot. And so we developed this program where some of the criteria that determined eligibility for these programs included things like family status, citizenship status, income levels, and so forth. And so what we did is we built models of these different characteristics, and then we identified individuals who are likely to be eligible and in need of healthcare coverage. But that's just the start. That just basically gives that list to start with. And this is the first part of that civic data science definition that I mentioned earlier. Once you get that kind of high-level data science product, you still need to roll it out. And so the much bigger part of this campaign was actually much more basic and fundamental data work. Coordinating the outreach of taking these lists that a bunch of PhDs put together and translating that to things that you can give to people who are going and knocking on doors, and tracking how it goes over time so we can figure out where are we doing well, where are we doing poorly, and how can we improve. That's really fundamental stuff, and I consider that data science as much as the predictive modeling, machine learning, et cetera, simply because I'm using a definition of data science which basically treats any scientifically driven use of data as data science, that it's not about the fancy stuff. It's about getting the fundamentals right and building on it from there, because one thing I've found in all my years of doing this is that, garbage in, garbage out. That if you have crappy data, no matter what you do to it, it's not going to be as good as doing something really simple with data that's pretty solid. So another area that I've worked on is around substance abuse treatment and outreach. So this is something we're doing in the city now. We're working to build different apps for the city's recovery services programs to allow people going out in the field to better track their interactions with people who are dealing with substance use disorders or mental health issues, and being able to track the effectiveness of these different programs and eventually moving towards looking at the effectiveness of different kinds of interventions, both with individuals and geographically. We're also looking at potentially expanding this to areas like coordinating treatment across different providers, so that if we see somebody in one of our street teams for the Office of Recovery Services, and then somebody comes to an emergency room or a homeless shelter, that we're able to coordinate those records across places, and that we can follow up, so that if we've connected somebody to treatment, we can see have they stopped going? Do we need somebody to give them a call and make sure that they're still on track? And that we can coordinate services, because if somebody is having addiction problems, they're probably having other problems as well. They might have problems with housing or with access to food and other kinds of health care. And if we can make sure that they get that kind of coordinated care, it's much more likely that they're going to eventually get sober, get off the streets, get to be back living productive lives again. And we're also adding a layer of that more advanced analytics as well. So we piloted a program where we took people who were in the EMS system for things that weren't overdoses. So maybe they fell down in the street, or they got hit by a car. We piloted this program to see, can we figure out who's at risk of having overdoses? And turns out you can do that pretty well, actually. And again, it's one of those things where I mentioned earlier that the great thing about a lot of these algorithms is they're doing common sense at scale. In this case, it was that we were able to automatically read all of these EMTs reports. So we're not, again, finding some kind of associations you'd never expect. Instead, we're able to flag records where, for example, an EMT might note that they saw track marks on somebody's arm, or they had a syringe in their pocket, or something like that. And what this would allow us to do is to basically flag these records so that our recovery services teams could follow up and reach out and say, do you need access to treatment options? And the idea behind that is, if we can get, again, to these problems before they blow up to be a crisis to the point of somebody coming in with an overdose, we can be a lot more successful. The problem is if we don't know how to spot the people who haven't had overdoses yet, that's too many people to try to offer treatment to. That we need to find that sweet spot of getting a narrow enough group through targeting that it makes it's more effective to do that proactive outreach. Excuse me. Another thing I've done in this environment is to do fundraising. So basically everything I'm describing here relates to the work I did at the DNC. So there were 3 different areas that my team worked on at the DNC. I was there for a little over 2 years, created the data science team. We had one part of our work was to do voter modeling to identify who's likely to vote and how they're likely to vote and where people stand on issues and so forth. We had another program which did digital analytics to optimize our email and online fundraising programs. And then the third one was a new area for our team, which was to oversee all the direct marketing fundraising efforts. So direct marketing in this case is mail and telephone fundraising. So if any of you have received a piece of mail from the DNC over the past 3 years, sorry, that was me. Because basically what we did is we took this entire program in-house. So the DNC sends out somewhere between 1 and 5 million pieces of mail a month for fundraising. And so as you imagine, this is a huge program. And most of this mail goes to people who aren't donors. It's what's called prospecting. And the idea is simply, we have this list that we start from, which is the nationwide voter file. That has, including duplicates across states, about 200 million names and addresses in it. And from that, we need to figure out somewhere between 1 and 5 million people a month to send mail to. And you can do some basic screens. For example, in states with party registration on the voter file, which is about 2/3, sure, let's cut out the Republicans and maybe the independents. That makes sense. you can come up with some other ideas. One of the things that I found when I came on board was that we'd basically stopped sending mail to anybody under the age of 65, because at some point somebody had done a test to say, they said, well, all right, let's look at what happens when we send out mail, and oh look, senior citizens, likely retirees, much more likely to donate. So you know what, let's just focus on them. And there's a few problems with that. Well, one of the problems is, I guess, what I would think of as a sort of longevity issue. Namely that if you are only taking donors over the age of 65, you're probably going to have to start recruiting new donors much sooner than if you were to recruit younger ones through natural attrition. But beyond that, the problem was we're not running a tiny program, right? We're talking 1 to 5 million pieces of mail a month. And so, if we were just some small nonprofit and wanted to cut out, 80% of our potential targets right away like that, not that big a deal if we're sending out maybe 10, 20, 30,000 pieces of mail a month, because there are enough new people getting into that group every time that we can continuously replenish it. When you're sending out up to 5 million pieces of mail a month, up to 50, 60 million a year, perhaps, you can burn through that list pretty quickly. And the other problem with that, of course, is that you are not learning anything that would teach you otherwise. So, imagine we get into the case, well, this is basically what happened when I started. So previously all of this targeting had been done by outside firms. And when we brought it in-house, we actually tested against initially the firm that had been doing it for the past couple of years, and then against a few other firms that were looking to get that business as well. We basically just divvied up the entire country at random, and we did half the list in-house and half of it externally and looked at performance. And what we found was interesting. For the in-house model, we said, let's just get rid of this silly rule of nobody under 65. And what we found just that first month was that's not even the most productive group anymore. That actually the 50 to 64 group, much better. And it's not that the initial finding had been wrong from years before. It's that they'd burnt out the list. Because the thing is with prospecting, it's to find people who haven't donated before. So every time somebody donates, they come out of that universe. They're no longer a potential target for prospecting. And so if you have a finite universe of people, you take out the best targets every month, eventually it's not that great a universe to target. And so what we found over time is we could, by expanding that list outwards and using a much more nuanced approach where we're taking into account a lot of granular things about, for example, donations to other organizations or responses to phone calls or door knocks from campaigns, by taking into account all those those more subtle signals, we're actually able to find a much more high return list than if we were to just use these really broad rules for determining who we mail and who we don't. But there are also things we can do within there is, for example, we can learn how to figure out what are the best appeals to send to each person. So we have a few different options for different mailers. And again, this was something where, the best of intentions from the people who had been doing it before, they made sense that they continuously were testing one mailer against another. If you've seen any of the DNC fundraising mail, you might have seen some version of the Democratic Party strategy survey. It's a survey which asks, what do you think about certain issues? What do you think the Democratic Party should do? And I hate to say it, but it's not a survey that's actually used for anything, really. In fact, there's just, most of the responses we get aren't even data entered. That there's some amount that gets keyed in just so legally we can say that we are, listening to what's being said, but really it's a fundraising thing. We used to internally refer to it as the Fleece Grandma survey, which, that always made me uncomfortable, honestly. And, one of the things I was trying to do was to encourage usage of other approaches, things that, might be a bit better fit for people who were kind of aware of what was going on there and wanted to actually know about, for example, what the DNC was doing with their money. And so the problem was that this survey, it performed really well when it was tested just among the whole population of people who were being targeted. That if you send out 50% of targets we're getting, this survey, 50% we're getting some other appeal, in general, the survey always did better. But that doesn't mean that it does better with everybody. And so one thing we could do is to go and say, all right, well, we do those tests, and we find maybe overall the survey works better. But this issue-based mailer that we could send instead, if we can identify the population that would actually work better with, then maybe we want to split across the mailings. And this is a thing that often happens with email fundraising as well, that there's a lot of testing that's gone on for years and years. Every time you get a piece of mail from the DNC over email, sometimes multiple times a day if it's getting close to an election season, that's been tested on hundreds of thousands of recipients, where they may have sent it out along with 8 or 9 other alternatives, subtle variations in things like the subject line or who sent it and so forth. And based on what came back, what the results looked like from, say, an hour or two of test period, that's what they determined would be the best thing to send to the entire list. And then the last thing we did with fundraising was to vary the dollar amounts we were asking for, because the normal ask in one of these mailers was for $25, $35, $50, or $100. And that was found, again, across many of these broad tests, to be the most productive range to send. But again, it's not necessarily the case that that's the right one to send for everybody. So for example, I mentioned a minute ago, we were finding targets who had given to other organizations. And oftentimes we knew how much they give to other organizations. So if I had given, say, $500 to Emily's List, it seems maybe not ideal that I would only be asked for $25, $35, $50, or $100 by the DNC, because if I'm giving $500 to other organizations, difference between 25, 35, 50 probably doesn't matter that much to me. Maybe you want to ask me for 100, 250, 500, or 1,000. And so what we were able to do is to build a model which said, well, what do we think the likely donation amount is for any given individual based on all this other information we have, which also includes things like, for example, from the census, what the average income or home value is in their area. We have things from consumer files where we could have estimates of the likely household income for that individual. And we could use all that to say, well, this is somebody we can probably get away with asking for a higher amount. And we found, when we were able to identify these likely high-value donors, we could send them mail asking for more money, not decrease the rate at which they respond by asking for too much, but really increasing the amount of money that they ended up giving when we did ask. So, all these strategies are ways that using data science, even the methods that are normally used for advertising, marketing, sales, and so forth, they can also be used to help nonprofit organizations in a very similar way. And then lastly, a project that we've been working on for the past year or so at the city. It's actually a collaboration with an outside group called Data for Democracy, as well as some people here today. We've been looking at ways to reduce injuries and fatalities on our streets in a lot of ways. This is in the context of a program called Vision Zero, which is an initiative that happens in many cities aimed at reducing traffic injuries and fatalities down to zero eventually by identifying different kinds of traffic safety interventions. And there's been a lot of work in the city to kind of track what's going on in terms of crashes that have happened, and there's a Vision Zero task force that meets every time there's a fatal incident to try to decide, was there anything that led to this outcome that could be changed, particularly around things like traffic signal design and so forth. There's also been other initiatives like what you can see here on this map. This is something called our Vision Zero Traffic Safety Concerns Map. It's a crowdsourced application that our GIS team put together that basically allows any member of the public to go in and pick a place around the city and identify things that are wrong. Might be things like, people don't, or cars don't yield to pedestrians, or pedestrians don't have enough time to cross, or there should be a bike lane here, or whatever the issue is. We at this point have, I believe, over 9,000 separate comments in here. And I think you can kind of see the problem there. This is just the area around City Hall. Basically, every intersection, pretty much every street segment, somebody's identified a risk. And the reality is we probably will never get to address all of these. We certainly will not address all of them all at once. And so we need to find a way to prioritize, to figure out, well, what kinds of interventions would make the most sense. And for us, that means, which of the things that people complain about are most likely to actually result in crashes with injuries or fatalities. So we've been working with a group called Data for Democracy to develop a predictive model for crashes on our streets. And the idea is simply that, how do we incorporate all of this data as well as things like traffic data, for example, from Waze or from our internal systems? How do we incorporate that as well as things like road conditions, maintenance of streets, and so forth, and come up with a plan for prioritizing our different interventions? Well, we can use the likelihood of crashes as a way to identify the highest risk places to focus on first. So we're developing this modeling framework, which part of the reason we want to work with this outside partner organization is that we want this to be transferable to other places as well. This is an open source project, and there's already discussions about extending it to other cities. So this is something that we're hoping to get to a point in the next few months where we can deliver to our transportation department, and they can look at that and really start to focus on the highest risk areas and prioritize their interventions to be much more efficient in terms of taking the limited resources we have and turning them into meaningful differences for the sake of traffic safety. So finally, if I've sold some of you on this idea of doing work in civic data science, how do you get involved? Well, a few things. First off, learn about the area that you're interested in. So, learn what data is out there. In Boston, we have a site called Analyze Boston. It's our city's open data portal. Other cities, like Cambridge, for example, have their own open data portals. There are other public organizations or even private organizations that share data publicly. So it's worth getting to know what data is available, see what's been done with it already, whether it's work from cities with teams like ours, or it's outside organizations or in the private sector, and get to know the relevant experts. That doesn't just mean the relevant experts in terms of the data community like our team. It also means, for example, if you want to do work in Boston, maybe get to know some of the people in the transportation department. They go and do a lot of community outreach and are very happy to talk to people in the community. So it really helps to make you an effective contributor, if you understand all the different programs and practices that are going on before you get too deep into the weeds of trying to come up with a solution. From there, you can volunteer. I'd highly recommend joining efforts with an organization that's working in these areas. So I mentioned Data for Democracy. There's another group called Data Kind. Code for America has Code for America brigades in many cities, including Boston, and they work on a lot of interesting projects. I particularly recommend working with one of these groups because it's much easier to coordinate efforts. Few of these problems can actually be solved by one individual working alone. That even includes, we have a team and we work as a team because even working full-time professionally, one person probably can't do all this stuff on their own. So on a volunteer basis, that's even more true. It's best to align your efforts with a broader group of people who can combine forces, and it also reduces some of the logistical challenges for the organizations that you might partner with. Contributing to open source projects or doing work with open data is a great way that even if you're just working on your own, if you can build something off of open data, share the code and the results, that can give others a place to start from. It might, for example, lead to something that someone like myself sees and says, you know what, this is an awesome thing somebody did with our open data. Let's implement this internally at the city, make this a part of our regular operations. And then finally, you can also offer your help to other organizations directly. The one caveat I would give is, don't be offended if they say no. We get a lot of people reaching out to us as individuals, especially from the various universities around here, offering to help. And while we really appreciate it, sometimes it's hard to coordinate the work of all that because, if you think about it from even the perspective of if we were to bring on an employee for a short period of time, as a manager, I don't expect a new employee to be really productive, to be net positive for probably 2 or 3 months after they come on board. So if you imagine a volunteer who's only working part-time, we don't know how long they'll be around for, it's often a hard sell to get them to a point where their contributions exceed the amount of work it requires to get them up to speed on our systems and infrastructure and all that. That said, there are some organizations, I'm sure, who would love the help. So don't let that stop you. Just would say, be aware that some organizations might not have a great place to put a volunteer offering to help on their own. And then finally, if you want to work in this area, there are a lot of organizations that do this sort of stuff. So find them out, make connections to them. There are also organizations like Data Science for Social Good, which do fellowships and connect people who have interest in these areas with organizations that need that kind of help. And then you can also work in the private sector and still work on these sorts of civic good projects. There are a lot of vendors who work in these areas. Do your research, figure out, is this one of the good ones? There's a wide mix of different organizations working in the civic data space. Some of them are more civically minded. Some of them just simply do it as a business opportunity, so it's worth investigating and understanding the companies you're getting involved with. So finally, the last point I wanted to make, and I kind of alluded to this earlier, for those of you who are considering a career in this area, even if you're the sort of person who wants to eventually go out in the private sector, make a ton of money working for Google or Facebook or whoever, or some startup that makes you, millions and millions of dollars by the time you're 29, I would still say that it would be a great thing to do to spend a couple years of your career, particularly early, working in the civic data science sector. And the fundamental reason why is that you'll be a better data scientist for it, that you get to work on more and more varied projects, you get to have more autonomy, you get to advance more quickly because these organizations tend to be really lean and eager for whatever skills you can offer. And if you want to learn something new, we can probably find a use for it. So compare that to going to one of these big tech companies where your first couple of years, you'll probably be the junior dev or junior data scientist on a large team. You'll be doing the data equivalent of getting coffee for everybody for your first couple of years until you're ready to be trusted with something more interesting. And so if you could spend those years instead working for an organization like ours, you're going to come out of it better at what you do and more prepared, so that even if for your second job you do end up going into the private sector and going fully mercenary, you'll still be much better qualified to do that and be a much more attractive candidate. But I hope I've also motivated you to do this for the sake of realizing this is interesting and meaningful work, and I hope some of you will join me in it. Thank you. So we've got a few minutes for questions if anybody has any. Jeff?
What do you see as the role of academia in civic data science? Because I know the priorities of academia are often different than what's useful for...
Yeah, and this is something I think we've been wrestling with for a while to try to understand. I think, as I see the role of academia, I think where it can contribute most is as a sort of R&D lab. Because, the priorities are different, but I think let's focus on where those incentives make sense. So what we are bad at is being able to spend a lot of time working on something that might not deliver results. That's basically the job description of an academic. So, in that case, working particularly with things like open data, and I say that as a recovering academic myself. I mean no shade with that. Working with open data or partnering with civic organizations, I think where you can contribute the most is to be able to do some of that real in-depth thinking that people in positions like mine just don't have an opportunity to do because we're being called to deliver things on a much more day-to-day time frame. Yeah.
So as we've heard from Sebastian and Arthur as well, there's often pushback against kind of bringing in algorithm data science into a lot of these problems. And you mentioned early on creating this kind of loop where it's supposed to help the people and not eliminate them, right? How often do you have to deal with this pushback? How do you address it maybe separately for the people whose job this is enabling and then more general?
Yeah, so I actually don't deal with a ton of pushback, but that might just be because I'm generally not pushing as hard as I might. So one thing we've actually consciously chosen to do over the past 6 months to a year is to slow down on some of this more advanced analytics work. And some of that is sort of infrastructural. That one of the things we realized, I mentioned not only the restaurant inspections thing, but that pilot model for predicting overdoses. The punchline to that story was that this was something that was done by a grad student fellow on the team in the semester just preceding my joining the team, so it's spring of 2016. My first week on the job, one of the things I did was come to his conclusion presentation to the Public Health Commission and Office of Recovery Services. The head of the Public Health Commission, the head of EMS and the Office of Recovery Services, and the research director at the Public Health Commission, they were all there. They all thought this was really cool. And then it came to the end of, all right, so what do we do with this? And nobody had an answer, because the fundamental problem that had come up was, well, this whole model's point was to identify people for proactive outreach before they had overdoses. And the recovery services folks said, that's awesome. The problem is we don't have enough capacity to deal with all the people who have overdoses. And maybe this could help us avoid that down the line, but right now, we have all these people, we don't have to predict whether they have issues that require treatment. We know that, we've seen it, we've transported them to the hospital for it. And so, I'm sad to say that kind of has gone nowhere so far. And this is one of the things we found that is a real challenge, is figuring out where this fits in the day-to-day workflow. So one of the things we've done on our team is to actually institute a new process for soliciting and selecting projects that we work on. And one of the key factors there is that we're not going to take on a project before the client, which might mean another department, or a department head or some partner program, before the client knows what they're going to do with it. That we even do written memorandums of understanding at the start of a project now, where we're not going to put our work into doing this unless they can commit to putting it to use afterwards. And so realistically, what that's done is it's cut down the number of projects we get like this. But that's okay, I think, because we need to start slow. It doesn't really make sense to say, all right, let's take an organization that 2 or 3 years ago, or maybe less, was doing everything on paper forms, and now we're going to give them a machine learning model. That's a real steep learning curve. I think a better approach for that is, let's take the perhaps recently digitized program, and now let's start by giving them a dashboard so they can see their program in action. Watch how it's evolving over time, give them ways to look up information, and start delivering some insights based on data. And then once you build that familiarity and trust, then you can say, hey, there's something else we can do here. And I found when it works that way, it's actually a lot easier, because but what you often hear is, what would be great? And that's the entry point, right? It's not about someone like me going to somebody in public works, telling them about all the wonders of artificial intelligence and trying to sell them on that. In fact, it's often the other way around. That it's when people hear about the kind of stuff we do, and they can think on their own, well, what problems do I have? So for example, one of the ones we're working on right now is around crash data, which is actually, we have issues with that because in part, the best records we have in the city often come from, say, our EMS system, where we have these really detailed records. Problem is, because it's health data, it's damn near impossible to share. And more to the point, though, it's a lot of work to go through and code everything. So we're actually looking at using natural language processing to read through whether it's records from EMS or police reports or 311 cases, building out systems which can essentially read these long-form descriptions and start pulling out key things like, for example, with a crash, was there a bike involved? Was there a pedestrian involved, and so forth? Was there any mention of, say, ice on the roads? These are things that we can build models into, and it makes sense to the people on the ground to say, oh yeah, you've got basically this program that is reading the text and flagging things that are meaningful. That makes sense to people, and I think once you get them to the point of familiarity with not only electronic records and tracking metrics, but also starting to do some of that analysis, then I think it's a much more natural extension. Others? Yep.
So kind of bringing that in a little bit and thinking about the communication and also about the data sourcing that you just mentioned.
Yeah.
How much does your office work with like going through and looking at whether the data was collected in a way that really captures the university trying to examine? Because I feel like the model's great, but as you said, garbage in, garbage out.
Yeah, data quality is a huge issue. And that's part of the reason we've slowed down on this stuff, because we've realized some of our fundamental assumptions we have to question. So one of the things that we're in the process of doing right now is building out a proper data warehouse for our team. So just to give us some sense of context, when I came on board almost 2 years ago now, our team had about half a dozen different databases that we stored data in. We had about 4 or 5 different tools we were using for processing data pipelines. We had no central repository that gave us information on what all that data was, what data we had even, but also what was being done to it along the way. You had to go and inspect every individual script. There was no documentation about what happened. It was just some vendor built a pipeline, and that got implemented 3 years ago, and that's now our 911 data pipeline. So we've decided to kind of start over with that a bit and centralize our tools and data, not only to just make it more convenient, but also to allow for some of that data lineage tracking and cataloging and collection of metadata and so forth, specifically for this reason, to be able to better understand what data we have. There's another actually really interesting exercise we did with our summer fellows last year, which I want to find a way to incorporate into the onboarding for anybody on our team. I've just got to figure out what form it should take. So we got this request around somebody in our mayor's policy office wanted to come up with an inventory of small businesses in Chinatown, because there was an interest in community preservation, because there was a general sense in the community that traditional businesses were getting pushed out in favor of chains and so forth, but nobody really knew what that meant in practice. This was all anecdotal. So we started digging in, and we realized we had no central inventory of businesses. We had, I don't know, 8 or 10 different data sources that kind of got at that, in terms of property use records or business licenses or, food permits, et cetera. We could kind of piece together records from a bunch of different sources, but they didn't all line up, and there wasn't any authoritative thing. So what we did is we took those records, we pieced them all together as best we could from a purely data standpoint, and then we actually went and walked. And we took our summer fellows as well as several staff, myself included, and we literally, took either laptops or printed sheets of, here are the businesses we think are in this neighborhood. Now let's walk these streets and confirm and see which ones we didn't get. We had plenty of cases where we would have overlapping records for the same property, and it was really eye-opening to realize, okay, well, not only are our records, not always right, but you could actually see some of the patterns in there. So, for example, you would see cases where a property might actually have a range of addresses. There was one, I think it was, I want to say 246 to 256 Tremont Street, which is basically a building that spans most of a block. We had some businesses coded as that range. We had one at 246, we had another at 250, which turned out was the same as at 246, and so forth. And you start to understand how all these systems go together. There's no conclusion that I've come to from that, other than we have a lot of work to do to really understand the underlying data, and that's absolutely a prerequisite for the more advanced stuff we want to do. Other questions? No? Well, thank you, everyone. It's been a pleasure talking to you.